I'm Dr. Cathy Budman. I am a professor of psychiatry at the Hofstra Northwell School of Medicine, and I am a specialist in Tourette Syndrome. I will be speaking about the use of medications in Tourette Syndrome and related disorders. When to medicate? A very important question that most families consider when their child is first diagnosed with Tourette's disorder is when and should we use medication to treat our child. Obviously, that decision to embark on medication is a big one, and there are legitimate concerns about side effects and long-term risks. So how do we make that decision? How do we decide when we're going to move from a non-pharmacological intervention to the use of medications? I basically look at three things. I look at how that child is functioning in school, with peers, and at home. Now, if the tics are only a problem with parents or siblings, that would not be, in my opinion, a reasonable justification for using medication. On the other hand, if tics are disrupting the ability to focus in class, if they're causing stigmatization and bullying, then these are bigger concerns. So when there's at least two or more adverse impacts of tics on day-to-day functioning, that's when that balance in terms of the risk and benefits may be tipped towards benefits. Tourette and psychostimulants. One of the most common questions that I'm asked by parents, particularly when attention deficit hyperactivity disorder, ADHD symptoms actually prevail over even tics in terms of adversely impacting on functioning, is do we use psychostimulants in a child who has tics? Won't that potentially make the tics worse? Well, this is a legitimate question because for years the answer was no, we don't use psychostimulants in tics. But now we have, for over a decade, more than a decade, we have an abundance of literature that shows that it's actually perfectly safe and in fact recommended to use psychostimulants for treatment of tics. Why? Because the studies show that it doesn't actually increase tics. In fact, the psychostimulants are the treatment of choice for ADHD, and by controlling ADHD symptoms, oftentimes tic symptoms actually improve as well. For more information, please visit the Tourette Association website at tourette.org.